Hello friends, this is the part 2 of the tooth eruption. We will cover various theories of tooth eruption. First is root elongation theory. It is the simpler theory which states that the crown is pushed into the oral cavity because of the elongation of the root. The evidence for this theory is that, as we know, that crown erupt because of the root elongation. But the evidence against this theory is that rootless tooth and submerged tooth do not erupt, but root elongation occur in case of submerged tooth. Second, pulpal constriction theory. Pulpal constriction causes sufficient pressure to move the tooth occlusally, but evidence for this theory is that we know that root dentinal growth causes constriction of the pulp. But evidence against this theory is pulpless tooth also grow at same rate, and there is premolar jump because of the premature extraction of the primary molar. Then coming to the third theory, that is growth of periodontal tissue, given by Underwood. He stated that periodontal tissue growth leads to the eruption of teeth and PDL pulls the tooth, but actually it is vice versa. It is the tooth which pulls the PDL during the eruption. Then coming to the another theory, that is pressure from muscular action, given by Burton. He stated that the muscles of the perioral structure squeeze the crown and helps in the eruption, but in case of unilateral facial paralysis, tooth also erupts. Now coming to the another theory, that is resorption of alveolar crest. As we know that resorption at the alveolar crest region leads to the tooth eruption, but evidence against this theory is we know that alveolar crest is the site of most rapid and the continuous growth. Coming to the hormonal theory, given by Arthur Keith, he stated that hormones from thyroid and pituitary glands helps in the eruption of teeth, but this theory does not explain the mechanism. Then coming to the cellular proliferation theory, given by Noyes, he stated that the osmotic pressure and forces from the cellular proliferation in the pulp causes the eruption of the tooth. Coming to the vascularity theory, given by Constant, he stated that the blood vessels between the developing tooth and the bone surrounding the tooth leads to the eruption of the tooth. But in case of periodontitis, the hyperemia in periodontitis cause supra-eruption of the tooth. Then coming to the next theory, that is blood vessel thrust theory, which stated that hydrodynamic and hydrostatic forces within the blood vessels causes the eruption of the tooth. Then coming to the periodontal contraction theory, it is stated that there is contractile element like fibroblast present in the periodontal ligament, which helps in the eruption of the tooth. Then coming to the another theory, that is dental follicle theory, which stated that dental follicle is essential to achieve the bony remodeling and helps in the eruption of the tooth. Then coming to the last theory, that is bony remodeling theory, which states that the bony remodeling occurs in the pre-eruptive phase, helps in the eruption of the tooth.